Well, hi everyone. Daniel Williams here, senior editor at MGMA and host of the MGMA Podcast Network. We are back with another MGMA Member Spotlight podcast. This is another one of our special edition podcasts because we are again recognizing one of our award winners. We've got Anu Banerjee. He's a PhD. He's got his MS degree in MHA and is an FACHE. And Anu is the honoree this year for the MGMA Harwick Innovation Award. We are so happy to have him here on the show. Anu, welcome. Glad to have you here.
Thank you, Daniel. Same here. Appreciate it.
So, when you learned of winning this award, what went through your mind? How does it feel to be recognized for your contributions to healthcare innovation?
Thank you, Danielle. Again, appreciate it. And I think the idea behind receiving such an honor is just truly a signature event for me, specifically for my own life. Been in healthcare for a long time, and getting recognized for something that we're actually trying to do and change and improve healthcare is truly an honor. So I'm honored to be a recipient of this award, and certainly looking forward to make some true changes in healthcare through innovation. And my dedication and passion towards healthcare certainly calls for that kind of innovation. So looking forward to some amazing stuff ahead. And thank you again, MGMA, for this award and thinking of me as a recipient. Appreciate it.
Yeah, and we're going to dig deeper into the innovations that were discussed in your nomination and the work that you're doing there. First of all, let's just look at your background. You have a lot of letters after your name. First of all, congratulations on all the continuing ed and the work that you've put into your academic career. Tell us a little bit about the work that you're doing right now, where you're located, and the kind of work you're doing in healthcare.
Yeah, would be happy to. So been in healthcare for about 18, 19 years. So far, mostly healthcare systems. Currently, I'm located in California. I work with the state of California prison system. And recently, I had this passion of developing something. Certainly, the world is moving towards more digital solutions. So we do need to ensure that healthcare is available to those who truly cannot afford it. Healthcare being one of the highest cost GDP factors in our country is actually making us really hard to actually deliver care at a lesser cost. So we are targeting people who are actually cannot afford cost. We are targeting people where they truly need it without the primary care providers or the specialists available to them. So the goal was actually to understand this need and find a solution that we can reach out to these patients and help them to actually take care of them at home itself, because they may not even have a car to go to a doctor's office. And this is extremely hard for us to actually apprehend, because we sometimes feel like healthcare is all a very fancy location between brick and mortar locations. That's not the case. I think healthcare has to exist at patients' home. And how do we help these patients without having actually bring them into the hospital system is the core root of this innovation. So that's the idea behind it.
Yeah, so you and I were talking offline. We were discussing how deep you should go into what that solution is, what the innovation is, and I'm not sure we really locked down exactly because it could be a little difficult depending on how detailed the solution is. But if you don't mind, give us sort of the overall idea behind this solution and this innovation.
Absolutely. So I think the idea behind this whole solution was to actually reach out to patients, give them that power, empower our patients to become the owners of their own health. I think the biggest piece that we actually sometimes miss in healthcare is to involve the patients itself. This solution actually allows the patients to be engaging themselves, their family members to be engaged in their care, at the same time empower them to actually understand their own health better. We don't want to monitor healthcare by just doing work that is actually happening only in offices and hospitals. Doctors' offices and hospitals is actually a very small percentage of that healthcare. So the solution actually focuses on connecting patients' health that they can actually monitor at home and connecting them with the specialists and primary care offices in areas where the doctors are available. So telemedicine was actually a spike when COVID came through, and telemedicine became a huge deal because people wouldn't be able to actually come out of their homes to reach to the doctor's offices. But beyond telemedicine, what really needs to happen is understand their health at home, monitor them at certain amounts of time, at times where we really need to monitor them without having that fear of those patients to actually come in the office. We have heard about white coat hypertension, masked hypertension. As soon as they come to see a doctor, their blood pressure automatically rises. As soon as a nurse actually is taking a blood pressure, the blood pressure automatically rises. And we take care of those patients based on an increase in medication, a decrease in medications, or giving them some kind of a therapy treatment. But we do truly need to understand that how do we connect patients, empower them to actually understand their health better, and then connected with the doctors on an everyday basis. So the doctor is not blindsided by those 2, 3, 4 readings in the office, but the doctor has a full picture drawn in front of them. What happens to be the case usually is doctor makes a decision for treatment plans based on only 1 or 2 readings. Now we are actually opening that up for thousands of readings and then algorithms that are actually helping the doctor to understand the proper signature or the proper side of the patient's health. And that's extremely important for us to understand that what is the patient actually going through from their starting of the day to the end of the day and throughout the day. And I think that's the key behind it, is to empower patient through monitoring and help them to connect it with the providers that if required.
Yeah, thank you for sharing that. So, how does the solution work? What is it? Is it a monitoring system? Is it something that's a device that attaches to the patient? How does that work?
So the solution is actually developed in such a way that it's never dependent on 1 or 2 devices. You don't want to bind your patients to force them to use only 1 or 2 devices. The solution actually interacts with any device out there that's actually readily available to share data. Now, the data sharing platforms could be anything, right? Like you could probably say, I love to wear wearable devices, but I don't like to wear huge wearable devices on me to actually monitor myself. I like to wear a cuff, but I'm not really sure whether I'm doing the right measurement or not. So we want to make sure we consider patient into this mix. So it's a patient-centric solution. It picks up from any of the devices that the patient have. It could be a Bluetooth scale that you try to weigh yourself on every morning in the bathroom, and it picks up data through Bluetooth. So I think the solution has to be flexible enough to fit a patient's everyday routine. You cannot force patients to actually say that do this at this time of the day only, otherwise the solution doesn't work. So that's how we are actually picking up data from most of the devices, watches, or any other wearable devices that we could actually think of, including continuous blood pressure, continuous blood sugar monitoring devices as well. But idea is not to just focus ourselves only on vital signs. We have to expand ourselves and give patient the power to actually monitor themselves for diets, their exercise, the steps that they take, the stairs they actually climb. All those data elements should come together and help the patient understand, am I doing the right thing, or am I just taking the 5 milligrams of medication that I was prescribed? I think that's where the shift is going to happen. And in the next few years, we're going to see the shift happening more and more.
Yeah, thank you for sharing that. So, in looking at your nomination, your platform focuses on helping underserved rural populations manage diabetes and hypertension. That's a focus of it. What were you seeing in your data, in your research, where you really wanted to focus in this direction? What was happening there?
Yeah, so what we were seeing actually, that patients who were actually getting monitored only 3 to 4 times a year are not the right way to be monitored. Patients who are actually getting stressed because of just coming to the office is not the right stress that they actually need. So patients who are monitoring themselves 3, 4 times a day are now seeing their own themselves into their mirror saying, hey, I'm actually going to do better here because I'm going to increase my 30 minutes exercise and try to measure again. And I'm going to try to improve my diet and measure again. So the patient is getting empowered more and more. What we actually saw is the amount of stress, amount of visits to the hospitals are going down, amount of medications that the patients are taking. I think everything impacts when the patient actually is empowered of their own health. One other thing actually that we are noticing is that previously the patient only saw the doctor when they had an appointment. They are not really involved in their care. Now we are seeing that the patient is not only involved in their care, but a 92-year-old would probably involve their daughter or their granddaughter to say that, hey, could you please help me to actually put this together? So what we are doing is we are involving families and connecting them as well. And to improve patients' health, to improve their blood pressure, blood sugar, or any of those vital signs, we all know it's very critical for you to actually get involved with your family members. Your behavior, your socialism actually impacts your health, and it improves drastically. So those are some of the things that we are noticing.
Okay. One of the really interesting things I saw about your program is that it not only monitors and manages hypertension and other issues related there physically, but also gives some readings on mental health. Talk about that. How does it interact and be able to get data related to mental health issues?
Yeah, so I think the idea behind any blood pressure monitoring nowadays is not limited to only diet and exercise anymore. We all know that society today has a lot of stress, a lot of elements that actually put a huge amount of mental stress on ourselves, as well as you can see around the community that mental health is getting more and more prevalent. So we needed to ensure and understand their mental health status, their status of actually sleep disorders, their socialism disorder, their financial metrics, their social determinants of health. All these factors also impact blood glucose and blood pressure as well. It's very important for us to understand those factors and continuously monitor them and help them to actually improve it as well. But if you keep talking to a patient through a provider perspective, it makes a whole lot of difference on the patient's life, because now they're seeing, you know what, I'm not by myself anymore. I've always someone to talk to, and I've always someone to actually help me understand that what's happening with my life. And that makes a huge difference on your mental health. So that's our core concept of actually trying to measure mental health, as well as social determinants of health, including sleep is actually getting to be one of those factors as well.
So far, what have been the biggest challenges to the platform, and how have you been working to overcome those challenges?
That's a great question. And I'll tell you, one of the biggest thing that we actually get challenged with is sustainability. So we have patients who actually have used the solution for more than 6 years nonstop. What that means is that they are so dedicated to actually make a change in their own lives. People who are, I was giving you an example of a 92-year-old patient who has never picked up a cell phone before, never had cell phone in their life, and now actually is using a cell phone, is actually trying to get involved just because they know that they can actually take power of improving their own life. So I think one of the biggest challenges is sustainability and continuous involvement, so that it does not look like the first 90 days or 120 days, they're very active to use it, and then suddenly the usage goes down. We're actually seeing a steady increase and a steady usage for that sustainability plan. So that's one of the challenges that we always have, but we continue to work on it with our patients to help them, to support them, to give them some kind of a feedback, even if they're doing good. You and I are probably patients who probably would have good blood pressure readings. But if no one is talking to you, you may probably lose interest sooner or later. So we want to make sure that we have that continuous dialogue going with the medical care team. And that dialogue going back and forth helps us to sustain it.
In looking at the information that you sent over, at least based on the information I have, you have 3,000 patients currently using the platform. It's primarily from underserved populations. Talk about the feedback you're getting from that population and also from the clinicians and providers who are serving them.
So I think the overall feedback that we received is phenomenal. I mean, we are just so happy and impressed that we put something like this together for our own patients and seeing that feedback coming from them. One of the what I would like to say is it's a heart-touching feedback that comes from patients, is that I can see that my doctor doesn't just see me when they want to bill me. I think that's one of the key things that we see, is that the interaction between a provider and patient is only for a billing code and a billing perspective. We are moving away from that. What we are trying to say is healthcare is no more a bill. Healthcare is actually an interaction between a patient and provider to improve health of the patient. And I think that's one of the key things that they're noticing is that they are so involved in their own care, along with the provider and the medical staff is so involved with them that they are now becoming a part of the family in your everyday activity and routine. And I think that's the feedback that we receive. So it's very heartwarming for that.
Yeah. Got a couple more questions then before we sign off.
Sure.
So, do you have any success stories you could share with us about people who have been involved with this platform and have seen improvement?
Yeah, we have multiple actually cases where we have seen and patients have come up and said that a huge drastic change in their lifestyle, a huge drastic change in understanding their own health. Previously, they did not monitor themselves in terms of understanding their health. It was more of a case-by-case basis. Yes, if I feel bad or if I feel a little uneasy or anything of that nature, my blood pressure reading for the last 2 times was higher, then I will probably call the doctor's office and set up an appointment. That's pretty much was my maintenance of my life. Now I'm actually getting engaged in my own care and making that happen. We have multiple cases where patients are actually coming to us. The second case situation, as I mentioned before, patients who never had technology as part of their lifestyle, patients who were only saying, I would drive a car to go to my doctor and see a physical person in an office. And that's the lifestyle I've lived with for the last 80 years of my life. We have actually serving a patient that are actually average age of more than 64 years old. So you can imagine that patients are getting involved into that level of technology, wants to get involved. And even if they have never used it, now they're getting and training others, even training their friends and family to do it. And I think that's incredible when patient is trying to be advocates for other patients to become part of it. The second bandwidth is the opposite extreme of that 64-year-old, a 24-year-old who's actually coming up with diabetes and hypertension and these kinds of things. As you know, that our newest generations are actually having a lot of mental health issues and stress issues and hypertension issues. And there's some also have diabetes and things like that. And when those things happen, the youngsters are also getting a part of this thing. They are thinking that, hey, not only actually go to a doctor who is boring and just want to just see me for and give me a medication, but also there's a cool factor behind developing something that actually I can click a picture of my own lunch and send it out to my doctor. So my doctor knows what I'm eating versus what they're actually doing. So we have that both sides of the coin that we're seeing, the extremes of those ages. But these are some of the case situations that I can share you with.
I love that. So you are someone in healthcare, you are looking for innovation. You are thinking outside the box. You're looking for solutions for patients. For our MGMA listeners who may be seeing problems out there and putting their minds to, well, here are some solutions here, here are some innovations here. What advice would you give them to see one of these innovations all the way through to the finish line?
That's a great question. And I think every leader has the right heart to do the right things in healthcare. I don't think so. I believe that every healthcare leader has the right heart to do the things. But what we sincerely lack is actually we get so much carried away with the finances, with the models that we have in healthcare, sustainability of the own healthcare institution. I mean, we do get carried away. And that's what actually carries us away from innovation. But innovation is not something that happens only once. We need to continuously innovate. The innovation is not about developing something that will be flashy. It's actually developing a process that will help patients to improve care. So if we change our models to actually say that, hey, we are trying to provide innovation in our healthcare system, but we want to make it patient-centric. We want to see that how can patients make use of this thing? And I think that's the key advice that I would like to give leaders that try to drive innovation with that passion, that it has to be driven by patient-centric care. We are always driven by the other sector. If we can't sustain our own healthcare system, how are we going to be able to actually run anything like this? But as and when we get a chance, as and when we can actually improve healthcare through innovation, we continuously have to come back and try new things and adapt new things, talk to our patients and see what they need. But that's kind of the key factor behind driving innovations and making that sustain through the healthcare system.
Okay, final thought then. You have the platform out there, 3,000 patients. What's the future of it look like? How do you see it evolving? What's your goal for it?
Thank you for asking that question. And I certainly strongly feel that I think healthcare is not going to be limited between the four brick walls of a hospital system anymore. Healthcare is going to shift more towards patient homes. Healthcare is more going to shift from that fancy exam room to a living space where people actually make sense out of it. So the idea would be to understand that how we can actually provide these kinds of care, keeping in mind that hospital systems are not just going to be providing care at the hospital only. So where do I see this future moving? I see that the patients are actually not going to be going to the primary care provider as much as they do now. Patients are going to take that empowerment under their belt. They are going to actually start improving healthcare, and they're going to take power of their own health. And I see that actually because the patients are going to see themselves changing their lifestyle so much. And I think that's the idea behind understanding that how we can improve healthcare. The shift of this healthcare is not going to happen just by giving them one or two solutions. The shift is going to happen if we continuously keep bringing these kinds of innovation to our patients and then see this healthcare shifting.
Yeah, well, Anu Banerjee, recipient of the MGMA Harwick Innovation Award, thank you for joining us on the MGMA podcast.
Thank you so much again. Really honored to be here. Thank you very much again for the award.
All right. Well, that is going to do it for this episode of MGMA Member Spotlight Podcast. We've been talking to Anu Banerjee. He is the MGMA recipient of the Harwick Innovation Award, and we will put in the episode show notes ways that you can have a nomination for that prestigious award and our other MGMA awards in our episode show notes. Until then, thank you so much for joining us today and for being MGMA podcast listeners.